But
okay, Jonathan, let me
same.
ask you. We hear it's an ethical issue. We hear it's a human rights issue. Is that a winner if you take it to the public on that basis?
No. I think if there's one lesson we've learned about health reform in the last few decades, it's that being right doesn't count for very much. We can come up with lots of stories to evoke moral outrage. And by the way, it's not just about the uninsured. There are many Americans with insurance who have inadequate protection and who file for bankruptcy every year because they're underinsured. But if we're going to fight this battle for health reform on moral grounds, we're going to lose.
There's one patient of good old Harry left. It's me. I'm Artie. And I've heard this discussion about the 47 million. Fine. But look, I've got a job. It's a stable job. And I've got a health plan. If you tell me that these 47 million are going to increase my taxes or will increase my copays, which I'm frankly real sick of, I'm not with you. Unless you can tell me that there's something in it for me, I ain't there. Is there something in it for me? Whoa, 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 whoa. The dormant panel comes alive.
We heard about the IOM study on the consequences of the uninsured. I was on that committee, and what we documented clearly were that the consequences, when you live in a community with people who are uninsured, you are being affected through the inadequacy of the public health system, the diversion of resources. You're being compromised because of the effects on your hospitals and your physicians in your community. At the end of the day, we could go through a laundry list of those things, but the consequences of uninsurance affect those who are uninsured and those who are insured who live in that community. All of us are in the boat together.
I would also add, just on the cost issue real quick, just going back to talking to you, the patient, and I would start off saying, yes, it's a moral issue, and yes, it's going to be expensive, and yes, your taxes may go up a little bit, but I'd also say that recognize for these 47 million people, 12 million, we already have a program for you, either Medicaid or the Children's Health Care Plan. So that takes it down to, what, 47 down to 35. 10 million are non-U.S. citizens, still have to deal with, but whether it's community health centers or how we deal with it, still have to deal with. But they're probably, and probably 8 million make more than $50,000 a year. So the uninsured is not really the 47 million, it is, but in terms of what you have to worry about in terms of finances is this hardcore, probably 20, 25 million people. Secondly, I would say you're paying it right now. You're paying a premium of $235 every month for your private health insurance. $70 of that goes directly to the uninsured right now. And then thirdly, I would say you're already paying the American taxpayer $50 billion for the uninsured, for those 47 million. $50 billion is already going to the uninsured. Why? Because we have legislation that if uninsured comes to the emergency room, you're taken care of. So I would begin that explanation because we're already paying for a lot of care for the uninsured in a very indirect, untransparent, inefficient way.
But $45 billion of that cost comes from the cost of taking care of uninsured people or inadequately insured people who are working, but their employer does not provide health insurance coverage or good health insurance coverage. So unless this is a shared responsibility where all employers either cover their workers or contribute to a fund, we're not going to have the resources that it takes to do this right.
Is this a winning set of arguments? I didn't hear anybody say that my monthly payment, which he understated, will go down. Can we win with this?
If you promise everybody coverage, we can put the plan together. But it goes back to where we started, that if every health insurance is still going to go up 3 times as much as wages every year as it's done on average the last 40 years, no. Because we can make everybody feel good, but if the internal costs are still driven up 3 times faster than wages, it simply cannot be sustained.
I think, first of all, let's be honest about the price tag for universal coverage. The price tag really is not that much. If you talk about adding the uninsured to the existing system, you're talking about roughly $100 billion a year. Well, we already spend over $2 trillion, so it's a markup, but not much. When we cut taxes in 2001 and 2003, we found the money to do that. When we passed the Medicare prescription drug benefit in 2003, we found the money to do that. When we went to war in Iraq, we found the money to do that. So this is a question of priorities. And the uninsured are not a political priority. And it's not that they're unaffordable. It's that we haven't chosen to pay that money. In terms of a winning argument, I think the senator was on to something there, which is that one of the untold stories is that healthcare costs are crowding out the wages of American workers. If you look at American workers and the growth in wages since the 1970s, it's essentially eaten up by inflation. So where's that money going? Well, a lot of that money that should be going to higher wages and salaries is going to pay their healthcare bill. And so we've got to make that economic case that this is good for American workers, but we need allies.
Okay, you've overpowered me, I'm convinced. Therefore, through the magic of hypotheticals, whereas we've spent the day in 2009, we're going back to 2008. And I suppose now that I'm a convert, I am delighted that both political parties in this year of a presidential election are talking health care. So on this beautiful spring day, I've taken my nephew, Sam, who's 25. He works at Mega Mart, which doesn't provide health care. And we've gone to Fenway Park. We're there to see the Sox play.
To make Tom Lee happy.
And we're talking about the fact that Sam doesn't have health care. And I guess as we're sitting there in a very slow pitcher's duel, we want to review first the Republican platform. Senator, what is it?
The Republican platform manifested by Senator McCain is, number one, no mandates, no employer mandate, no individual mandate. Number two, it is a $5,000 refundable tax credit, so it has meaning to people who are very low income, for a family of four, or $2,500 refundable tax credit for the individual. Thirdly, John McCain's plan eliminates the employer-sponsored deduction, which has really been the backbone, the real bolster of our employer-sponsored system, which insures about 162 million people today. And the fourth, for the people who cannot get an insurance plan, it's out of their reach, he wants to give directly to the states grants through which they could get coverage.
So how is that going to affect Sam, the 25-year-old without employer coverage?
Sam basically gets a check, $2,500.
What's it going to do for me, Artie, where I've got health coverage from my employer?
The first thing your employer may or may not do is all of a sudden your employer was putting about $6,000 in to subsidize your health care plan, or say $3,000, and the federal or the American people were subsidizing your health care plan because you get a tax deduction.
I loved it.
That's right. So your employer may say, well, the government's not helping me. The American taxpayer no longer is subsidizing your plan $3,000. Therefore, I'm going to stop offering health care, and you figure it out. You get your $2,500 to $5,000.
What the hell am I going to buy with $2,500?
Well, that's going to be what our insurance friends here can offer. A plan today for a family of four costs $11,500.
In front of Artie and Sam at Fenway, there are two other fans. There's Karen and there's Sarah. So what do you say to Artie and Sam about this Republican platform?
Well, I think you better look at that twice. As he said, many employers may drop us and leave us on our own, in charge, but trying to find health insurance in an insurance market that's going to be deregulated. And what that means is they may not take me if I've had any kind of health problem in the past.